Operation Parent is a nonprofit. We're built on one simple belief: conversations matter. We help parents and caregivers feel more confident, having real, everyday conversations with their kids, especially about tough topics. Because when those conversations happen early and often, they make a lasting impact. That's why we offer webinars like this, to share practical tools and expert guidance so you can feel more prepared and supported. Next Tuesday, Dr. Bonnie from Stanford Reach Lab will discuss nicotine pouches and how to resist trending substances, as well as sharing the lab's resources for parents and schools for prevention and quitting. So we hope to see you then. In the summer, coming up super quickly, Dr. Lauren Hartman will help us reframe food and body confidence for youth with good family habits and hope, while standing up against media messages and overuse that might impact self-esteem. And then in July, Truth Initiative will join us to discuss nicotine and how to help kids both avoid it and quit if they are using. So please join us for these upcoming webinars. Today, we're here for Inside of the Medicine Cabinet, talking with youth about meds. First, I'd like to introduce you to Amy. She is the Director of Clinical Social Work, Adolescent Substance Use and Addiction Program at Boston Children's Hospital. She's been serving as a social worker for over 15 years with a strong passion for community and mental health. She is often the co-host on Awkward Conversations with Jodie Sweden, who you may know from back in the Full House days. She will join us a bit later in the webinar, and we could not be happier about that. Cori Hammond has her master's in public health. She is a director of prevention services at Partnership to End Addiction, a national nonprofit organization based in New York City, where she has served countless community prevention partners for over 9 years. Cori received her Bachelor's of Science in Public Health from Tulane and her Master's from New York University. We're so excited to learn from Cori today. Thanks for joining us.
Thanks so much, Michelle. Thank you for having me, Operation Parent, and the whole team. I'm so excited to be here with you this afternoon. I see the fun facts for me at the bottom. Amateur weightlifter is almost a little too serious, extremely amateur. But I want to briefly talk about Partnership to End Addiction. So my organization, we're based in New York City, and we have 3 main priorities. The first is to keep youth substance-free as long as possible. The second is to increase access to effective treatment for young people. And the third is to empower families as agents of change. So I work on Partnership's prevention team, so I mostly work within that first priority. And that's a lot about what I'm going to talk about today, how we can keep youth substance-free for as long as possible. Our website is drugfree.org. I know we'll go into some of the resources at the end, but please visit our website for more information and resources. Here are our takeaways for this webinar. The first is to recognize potential dangers that may be commonly found in our household medicine cabinets. The second is to know how to effectively discuss medication safety with young children, adolescents, and that young adult population as well. And the third is to understand the reasons why young people might misuse medication. And when we understand the reasons why, we can help them to find healthier alternatives. I know they already mentioned, but please, as I'm going through, put questions that you may have in the chat. And I know that Michelle and team will share us with those at the end. So you may not know it, but your medicine cabinet might be one of the most dangerous places in your home. Regardless of your organizational style, mine looks a little bit more like the one on the right here. There's many substances and products that we keep around for very legitimate reasons. that we don't always think about can pose a danger to young people. I've circled some on this slide here. You might think about what's in your own medicine cabinet. And so I'm going to go through a selection of what might be lurking in the medicine cabinet and the risks that they might pose to youth. And so the first category is over-the-counter medications and some other common dangers. The first of these is cough and cold medicines. I'm sure we all have a variety of these in our medicine cabinets. They're very handy, especially during the winter months. It's important to know that some decongestants and cough medicines contain a very effective medicine called dextromethorphan, otherwise known as DXM. And so in large doses, DXM has side effects that can include hallucinations and sensory changes. It can cause a high. Other cough medicines include codeine, which is an opioid that can be toxic to children in high doses. It's very effective at helping you to get to sleep when you have a really bad cough or cold, but when used in excess, it can be very dangerous. And so this data here on the left is from the Monitoring the Future survey, which is a national survey of 8th, 10th, and 12th graders. And this is showing prevalence in use of cough and cold medication to get high. And so as of last year in 2025, 5% of 10th graders said that they had used cough medicine to get high. And if we think about all of the 10th graders in the US, that's a lot of kids that are using this. And it's important to think about this, it's not just older kids that are at higher risk. 10th graders are actually at higher risk compared to older kids as well as 8th graders. So that incidence is higher among the 10th grade population. So definitely something that we want to be aware of. The next common one are allergy medications, so antihistamines. I know that I need antihistamines this time of year with seasonal allergies, and so I keep a lot of them in my medicine cabinet. This first line of antihistamines, things like Benadryl, ingesting more than the recommended dose of those can lead to hallucinations and can even be fatal. And unfortunately, there's now a common challenge on TikTok and other social media platforms that are encouraging young people to take more Benadryl in order to hallucinate because it can cause pretty mind-altering hallucinations. So again, another one that we want parents to be aware of. The next category are typical over-the-counter pain relievers. So things like ibuprofen, naproxen, aspirin, acetaminophen. So our Tylenols, our Aleve, all of these are commonly known as NSAIDs, non-steroidal anti-inflammatory drugs, commonly taken for pain, fever, inflammation. They're also found in some of those cough and cold medicines. And these are typically very safe medications when used correctly in the approved doses. They can poison the body if large enough amounts are swallowed. And so overdoses of these medications can cause upset stomach and vomiting, but also more serious things like kidney damage, ulcers, seizure, and coma. Also important to note that these are very toxic to pets. Even one pill can be fatal to a small dog or a cat. And so with these, we never want to call them candy or like magic pills or talk about these like they're going to cure everything, because that does make them more enticing for children. And talking about enticing for children, we know that many vitamins and supplements come in fruity, chewable tablets or gummy forms. These make these very easy to take and kind of fun and pleasurable to take. It does make them really appealing to kids. And we don't often think of vitamins and supplements as being dangerous, but fat-soluble vitamins such as A, D, E, and K can be toxic in excess. So you can take too much of them. Similarly, some of the minerals that are in vitamins, like iron, can be fatal to children in high enough doses. Water-soluble vitamins, on the other hand, any excess in the body is just naturally passed through the urine, but multivitamins contain both fat and water-soluble vitamins and minerals. It's also important to note that wellness trends are making supplements really appealing to teens who may be health conscious. So they might be tempted to take more than needed. If they don't understand the dosing super well, they might think, okay, 1 vitamin every day is good for me. 5 every day is going to be even better for me, when we know that that's very much not the case. So we'll talk about it soon, but making sure that kids understand dosing is really important. Slightly less common, but still important to talk about, are things like steroids, laxatives, and GLP-1s. Steroids may be misused on purpose by young people who are trying to build muscle, and we know that these can be dangerous for young people. Chronic use of steroids can cause stunted growth, organ damage, high blood pressure, increased heart attack risk, fertility problems, aggressive behavior, and depression. There's a lot of negative side effects for anabolic steroids. Laxatives may be misused by young people with disordered eating or eating disorders. And we know that chronic misuse of laxatives can lead to dangerous and even fatal dehydration and organ damage. And there's also been reports of children accidentally overdosing on GLP-1s, the new drugs for weight loss and diabetes management. And that is potentially going to become more common now that some of these GLP-1s are becoming available in pill forms as opposed to the injectable versions. So more to keep in mind. So moving out of the over-the-counter drug world, we want to talk about marijuana and nicotine products because we know that these are potentially common in people's homes. With the increasing legality of marijuana across the country, we know that there's a lot of marijuana edible products that are packaged to look like candy and other harmless snacks. You can see in the picture here, Stony Patch. Those are marijuana edibles that look very similar to Sour Patch Kids. Poison control calls due to marijuana edibles have skyrocketed in the past decade, with 75% of those reported cases being among children and adolescents who are accidentally ingesting them. And we know that accidental ingestion of marijuana products can cause seizures, hallucinations, breathing problems, and panic. It can really be a distressing incident for someone who takes a marijuana product and doesn't mean to, especially a young person. Nicotine also, we know there's a new host of different types of nicotine products. It comes in pouches, mints, gum, and other oral products that might be attractive to kids. And kind of different to marijuana, nicotine poisoning is possible and can be deadly for children. And that can be through drinking, vaping e-liquid, especially if it's flavored that kids might be interested in, eating oral nicotine products like these pouches, or even spilling vaping e-liquid on their skin, because nicotine is absorbable through skin, whereas marijuana and THC is not. And so the Poison Control Center is a really great resource. If your child ingests medication or supplements or vitamins or shows signs of any type of overdose, call the Poison Control Center or use their online web tool. If an individual collapses or has a seizure or has difficulty breathing, that's when you call 911 instead of Poison Control. But poison control centers take calls from people who, they might be unsure or slightly concerned. And the Poison Control Center has experts that know how to guide callers through deciding how concerned they should be, when something in emergency, and really just what to do. So we really want parents to know that it's not like calling the police or an ambulance where the bar is really high for that, and you don't want to call them if it's not an emergency. Poison control workers are trained to navigate every level of concern or just provide reassurance. So don't hesitate to call poison control in a situation where you might need some advice. And so now I want to move on to prescription medications. Many of the risks and warnings that I just discussed about unintentional ingestion or accidental poisonings are also relevant when it comes to prescription drugs. Many can be dangerous to young kids that accidentally get their hands on them and accidentally ingest them. But in this section, I want to focus on intentional misuse a little bit more. And so that doesn't really include, you accidentally took too much, a dosage mistake, or you accidentally took a pill that you didn't mean to, but this is intentionally misusing prescription drugs. And so what is prescription drug misuse? It's when someone uses medication in ways that weren't prescribed by that person's own healthcare provider. So that could mean using more than the amount prescribed, using beyond the prescribed time period, using for a purpose other than that for which it was prescribed, and using a drug that was prescribed to someone else, maybe. And so we know that the prescription drugs, they're commonly misused to self-medicate difficult emotions or mental health problems, or to enhance or counterbalance the effects of other substances like alcohol and other drugs. The types of prescription medications that are commonly misused include prescription pain relievers or opioids, so things like Vicodin or OxyContin, benzodiazepines, tranquilizers, or sedatives. So that would include things like Xanax and Valium, but also sleeping pills like Ambien, and also stimulants, such as those that are prescribed to teach ADHD. So that would include things like Adderall, Ritalin, or Vyvanse. And so these medications are commonly misused because they're psychoactive. They either relieve pain or they kind of change our perception or make us feel better in some way. When we're talking about prescription misuse, we're not talking about antibiotics or things like that don't really have any type of psychoactive component. So let's talk about youth prescription drug misuse. I want to level set here and talk about how, the good news is that this is not common among adolescents. Really, not using any substances is the norm among adolescents. This graph here is showing abstaining by high school seniors. And so the orange line is past month non-use of substances, and the purple line is lifetime non-use. And so this data goes back to the mid-70s, and we can see it's been basically a consistent increase since then. One of the most important takeaways is that the majority of high school students are not using substances. They're certainly not using them regularly, and a lot of them have never used substances ever. As of last year, almost 3/4 of 8th graders, over 60% of 10th graders, and over 40% of 12th graders were lifetime abstainers, meaning they've never misused prescription drugs, but they've also never used alcohol, tobacco, marijuana, all of these other substances. So we want to instill some hope here in the beginning. Not using is very much the norm among kids. But to show some data on prescription drug misuse, here we can see this is use among 12th graders in 2025 in the past year. So about 13% of 12th graders last year said that they had used any illicit drug other than marijuana. And just under 10% of them said that they had used any prescription drug without a doctor's orders. So the important thing here is that the majority of illicit drug use by high school seniors is prescription drug misuse. And so it is kind of the most common form of illicit substance use. About 1/3, so 35% of adolescents and young adults between the ages of 12 and 25 had taken a prescribed psychoactive drug in the past year. So again, psychoactive drug means those ones that alter our perception or our mood. And so this would include things like ADHD medications, antidepressants and antipsychotics, as well as opioid painkillers. Again, not talking about things like antibiotics. So 35% of young people being prescribed this type of medication is not inherently a problem. But as we get down to the bottom of this slide, about a third of those people who were prescribed this type of medication ended up misusing it. So that's the problem. About 20% of adolescents used a prescribed opioid in the past year, and 17% of that group misused that opioid. And about 30% of young adults were prescribed an opioid in the past year, and almost a quarter of them misused that opioid. So that means either taking more of that opioid than they were prescribed, taking it past the point when they actually needed it, using it for what they didn't need it for. And so how are young people getting access to prescription opioids? The orange bars here are the teenagers, and the blue bars are the young adult population, so 18 to 25-year-olds. And they asked on this survey, for the most recent time that you misused opioids, where did the opioid come from? And for our teenagers, the majority of them were prescribed it. A smaller proportion said that they received it from a friend or a relative, and a much, much smaller proportion, just 7%, said that they bought it from a drug dealer or a stranger. And so that's important for parents to know. Like, we need to realize that the majority of young people who misuse an opioid are getting it for a legitimate reason from their healthcare provider. And so that's why teaching them about adequate use of these substances is so, so important. And so why would young people be motivated to misuse prescription drugs? Unfortunately, there's a lot of reasons. The first, and probably the most common, is to relieve mental health problems or stress. More than ever, young people are reporting feelings of anxiety and depression and stress that might make self-medicating with prescription drugs really attractive. We know that self-medicating is especially common if they have a mental health issue or a condition that's not being adequately addressed. And we also know that self-medicating in this way can lead to the emergence of a co-occurring disorder, which is where someone has a substance use problem and a mental health problem happening at the same time. And we know that that is very serious and more difficult to treat. So as much as possible, we want to prevent that co-occurrence. There's also social pressures. We know that a lot of teens think that prescription drugs seem less dangerous than other illegal drugs, so they might have more curiosity to try prescription drugs than maybe they would kind of more hard drugs that they might be a little bit more scared of. Misusing prescription drugs may be more normalized in their social or family setting. There might be a lot of misinformation about drugs' effects or the safety of these substances being spread by unreliable sources, whether it's social media or other sources of info. And there might be subtle or overt peer pressure or a desire to fit in or remain competitive with peers. Which leads me to my next reason, which is to enhance academic or athletic performance. It should come as no surprise that young people might be motivated to misuse prescription drugs to sharpen their attention or sustain a high level of energy or alertness. This is mostly when it comes to things like stimulants. You know, there's the belief that misusing things like Adderall is going to boost their academic or athletic performance. You know, if they take an Adderall or a Vyvanse that's not prescribed to them, they might be able to stay up later and focus more for studying for tests. And while these drugs might help in the short term, they have what's kind of called a boomerang effect for people that don't actually need them for a diagnosed mental health issue. It becomes less effective over time. So they need more and more of that medication to function normally, which eventually leads to an ultimate decline in their performance, whether it's in athletics or academics. And we also know that caregivers' attitudes and behaviors play a part in young people's motivations. Young people are more likely to misuse prescription drugs if their parents are lenient about substance use in general or lenient about taking medications. If their caregivers model unhealthy prescription drug-related behaviors at home, so if they're using pills for non-medical purposes just to reduce their stress or to get high at home, if they allow easy access to prescription drugs in the home, and if they're not talking openly and honestly about these risks, and if they're not talking openly and honestly about their expectations that their kids should not misuse medications, and that medication is something to take seriously and be responsible about. Some other risk factors for prescription drug misuse, many are similar to the risk factors for just any type of substance use and other negative health behaviors, like exposure to trauma, having behavioral or impulse control problems, having symptoms of a mental health disorder, and certainly having a family history of substance misuse or addiction could put a young person at higher risk. But we also know that young people are at higher risk if they are prescribed pain medications to treat pain. And so often for young people, this manifests in they have a sports injury and are getting prescribed opioids, or they get their wisdom teeth out and then they're prescribed opioids. And we know that commonly young people are getting more opioids than they might need for that injury or that dental procedure. And so it does create the temptation with all of this leftover pills that might make them feel good to misuse that opioid and use it potentially longer than needed. So what are some of the consequences of this? There's a lot of consequences. I think most notably is the legal consequences. Misusing prescriptions, using pills that aren't yours, using pills for longer or more than needed is illegal. And we know that this type of substance misuse can damage the brain during a period of intense brain development. It can damage the parts of the brain that are necessary for decision-making and memory and learning and attention. It can make having healthy relationships and doing well in school more difficult. It can impair mental health. It certainly increases the risk for other substance use. The risk for addiction is increased. And of course, there's a risk for overdose with prescription drug misuse. Some of the negative health effects of these, sorry, let me find my slide again. Here we go. Some of the negative health effects of these substances, opioids can cause fatigue, digestive problems, and breathing difficulties. Stimulants can lead to feelings of paranoia, high body temperature, and rapid heartbeat. Depressants like alcohol or anti-anxiety medications can cause slurred speech, shallow breathing, sleepiness, disorientation, and lack of coordination. At higher doses, all of these can lead to overdose and death, especially when combined with alcohol or other drugs. And so a little bit about mixing substances. The combination of prescription drugs and alcohol is especially dangerous. It can lead to liver failure, brain damage, and certainly death. We know that a lot of opioid-related overdoses often involve other substances. And stimulants and benzodiazepines are often involved in opioid overdoses in young people. And common effects include things like an altered mental state, vomiting, heart and liver damage, just really serious. And, I know that counterfeit pills aren't always a risk in our medicine cabinets, but adolescents need to know the potential danger of pills that weren't prescribed to them by their own doctor. And so that message starts in the medicine cabinet, but extends into their friend groups and other social circles. We know that the illicit drug supply has been adulterated today. And so drug traffickers and dealers may be cutting their drugs with more nefarious substances like fentanyl. And so today, April 29th, is National Fentanyl Awareness Day. And so it's really important that we're talking about this today. The illicit drug supply is not regulated, and so it's difficult for anyone to know what they're truly taking unless the medication has been obtained from their healthcare provider and a trusted pharmacist. We really want kids to be aware of this risk and know that, prescription pills might feel like they're more safe than things like heroin or cocaine these days. But unless they're getting those pills from their pharmacist and their healthcare provider, you never know what's actually in them, and they could be a risk. And so very quickly, I want to go through some signs of an opioid overdose. This is important for everyone to know. So things like stupor, changes in pupil size, clammy skin, having difficulty breathing, having a blue tint to their skin, and being unresponsive or in a coma. And the more people who we know that can recognize these signs, they can know when to step in when something's wrong. Naloxone, or the brand name Narcan, is our very effective opioid reversal drug. It's an opioid receptor antagonist. So basically, it reverses the effects of an overdose by binding to the opioid receptor instead of the opioid. And the great thing is that there's no negative effects, even if this is administered to someone who has no opioids in their system. So there's no harm done if someone is given Narcan, but they weren't actually overdosing. And so for that reason, it should be administered at any sign of an overdose. Having it accessible in the home can save the life of a young child that accidentally ingests opioids. It can also save pets. I have a friend who's an emergency vet, and she says that especially during the winter holidays, she has pets come into her office all the time that, accidentally got into the medicine cabinet, accidentally got into grandma's purse and found opioids and ate a few, and they use Narcan to bring the dogs back. So it's just a very important thing that anyone can have in their home in order to save a life. And so what to do in case of an opioid overdose? Call 911 first, administer naloxone if you have it. Try your best to keep the person awake. You can give more naloxone after a few minutes if the person does not seem to be responding, and CPR, and then put them in the rescue position on their side and try to, remain calm until EMS arrives. And these are things that we can teach kids too. And so how do we keep youth safe? I think this is kind of the most important part of this presentation. So we want to keep all medications, vitamins, supplements, substances like marijuana, alcohol, nicotine, any drugs out of sight and out of reach of children and teens. This goes for diabetes medications. This goes for vitamins. Anything that could potentially be dangerous when taken in too much of a dose, lock it away. Many medicine cabinets have child safety locks available, like this one in the picture here, and buy medicine with child-resistant caps whenever possible, even if it's going to be in a locked cabinet. We can model healthy prescription medication misuse as adults. And so that includes properly disposing of medication when it's no longer needed, not using medication not using more than we need or for longer periods than needed, and making sure that kids know that pills and medicine aren't the cures for everything and aren't always the best first option. For sore muscles, maybe we try a massage or an Epsom salt bath. Maybe we try that first before we reach for the pills to try to make us feel better. Another population that might need some reminders about medication safety is grandparents or other older adults who play roles in your children's lives. Elderly adults are more likely to have multiple prescriptions and are more likely to need to bring medication with them. Grandma or grandpa's pocketbooks might be a place where children and teens can find medications. Elderly adults might also be tempted to hold on to old medications and old prescriptions. They're waiting for another time when they might need them. And so we can discuss medication safety and expiration dates with them and help them find a drug take-back day or other settings like a police station where they can safely get rid of their medications. They can always get a new prescription. We don't have to hold on to medications when they could be potentially dangerous in the home. So in talking about all of these things with young kids, how do we start? With younger kids, so kind of kindergarten to 5th grade, elementary school age, we really want to focus on trust and safety. The safety way, you could say something like, we want to take care of our bodies, so we don't want to put anything in our bodies that might hurt us. Also telling them, don't eat anything that you find lying around or that a trusted adult didn't give you, even if it looks like a snack. And from the trust aspect, letting them know that if you ever eat anything or find something that feels unsafe, you can always tell me. Health and safety means the most to me. As kids get slightly older, middle school into high school, we want to talk about medication as something to take seriously. So again, when we have aches and pains, we can try some other things first before trying a pill. Definitely don't take any pill that was not prescribed to you by your doctor. Talking about dosing, some of the things that we take to help us feel better, like allergy or cough medicine, can be dangerous if we take too much. Dosage is very important, and that's why I'll be in charge of making sure that we take the right amount. Also, you could say something like, I know you were prescribed this painkiller by a doctor, but that doesn't mean that we have to take all of it. We'll make sure that your pain is managed and maybe use some over-the-counter NSAIDs like Tylenol or acetaminophen or ibuprofen when you're starting to feel better. We also want to talk about substance using behavior. We can talk about how prescription drugs may seem less harmful than other types of drugs, but they still work on the same parts of the brain as many illegal drugs, so they can still be addictive and they can still be dangerous. And talking about some of those motivations for using substances. If you have negative emotions or feelings of anxiety or stress, I understand that it can be tempting to try substances like painkillers to help with those. If you ever have feelings like that, we can work together and get help in a way to solve them in a safer way. As kids get older, in kind of college age or once they move out of the home, we want to focus on things like harm reduction. Again, don't take any pill that was prescribed to you by your own doctor. But if you are going to use a pill that maybe you don't know what's in it, don't use any pill or powdered substance alone. Always carry Narcan so that you're able to help someone in need. They don't have to carry Narcan to help themselves, but you never know what kind of situation you might be in on public transit or walking around a city. If you have Narcan, you're always prepared to help someone. And again, self-medicating. I know school is feeling stressful. I want to help you so that your stress level is reduced and you feel more in control. I'm worried that the substances that you're using to help you study might be unsafe. And again, about prescription painkillers. I know you were prescribed opioid pain medication for after your surgery. While you're with me at home, I'm going to hand them to you when it's time to take them. And when you go back to campus, I trust you to only use what you need. I can help you safely get rid of the rest. So being a really strong support in using medication correctly. Finally, in FAQ, we get this question from parents a lot. A parent might say, my child was prescribed opioid pain relievers after they were getting their tonsils out. And so since it's from their doctor, I don't have anything to worry about, right? Just because a medication comes from their doctor doesn't automatically mean that it's safe or without any risk. We want parents to feel empowered to ask questions whenever an opioid is being considered for their child. It's important to inform the doctor of any family history of addiction or mental health issues, as those could increase the risk of misusing that opioid. And parents should be aware anytime their child is prescribed opioids and take steps to monitor that use. So that means you can ask about non-opioid alternatives for pain relief, keep track of how many pills were prescribed and how they're being used, and try to ensure that only the minimum necessary amount is taken. Medications, again, should be stored securely, out of reach of others, and any unused pills should be properly disposed of to prevent misuse. Thanks so much for listening to my section, and now I'm going to pass it over to Amy.
Hi there. Thanks so much, Cori. That was so informative, and I learned so much already, so I appreciate your time. I'm Amy McCarthy Baluch. I am the Director of Clinical Social Work at Boston Children's Hospital's Adolescent Substance Use and Addiction Program, and it is such a pleasure to spend my afternoon with you all. One thing that I might just want to add on to what Cori was just saying about opioid use prescribed by a provider is that in many states, like the state I live in, Massachusetts, have something called the non-voluntary opioid directive, a voluntary non-opioid directive, VNOD. And so folks can fill out a form basically that tells their provider ahead of time that they'd prefer alternatives to opioids in the treatment of their medical care. So that might be something to take a look at if that would be interesting for you or for your family. But more so, to talk a little bit about what I do at Boston Children's Hospital, the Adolescent Substance Use and Addiction Program, also known as ASAP, is a part of our Pediatric Addiction Medicine Division. And so just as of 2 years ago, we became our own Pediatric Addiction Medicine Division, which makes us the first in the country to be involved in doing that work, which is really exciting and wonderful. I've got a link here if you'd like to learn more about the work that we do. But essentially, our addiction medicine division consists of 3 parts, one of which is the ASAP program, where we do outpatient substance use for families and young people up to age 30. We also have support for primary care providers and doing consultation and training and learning about treating pediatric addiction and substance use and misuse. And we also offer virtual outpatient counseling to those providers and their patients. And then we do research in terms of looking at these issues and trying to advance the field in terms of answers and solutions for the families that we serve. Let's talk a little bit about prevention and intervention with substance use. And so, I think one of the key things about substance use and what we're learning so much in the work that I do at Children's Hospital in Boston is that early intervention is critical and essential. And so what we know to be true is that the younger somebody has an experience or exposure or ongoing use with a substance, they're much more likely to have an ongoing lifelong challenge with substance use overall. And so we are now thinking of substance use as kind of a condition of adolescence where its roots often are in adolescent substance use as a whole. And so like many things in life, the earlier that we address it, the more successful or hopeful the outcomes are. Not to say that, of course, they aren't if we aren't able to address that earlier in life. One of the things that we talk a lot about in our program is kind of this cycle that tends to kind of come up when a parent or caregiver discovers that their adolescent was using a substance. And so kind of what that can look like is that the adolescent uses the substance, the caregiver discovers that they're using it. The caregiver then experiences this huge kind of, flow of emotions and reacts sometimes pretty, strongly and emotionally to that substance use. And then the adolescent experiences their own emotions and they react and they kind of shut down. They then will try to avoid contact and interactions with their caregiver. Their caregiver feels more shut out and worried and struggles to trust what's going on. And they might start checking up more and more frequently on the young person now at this point because they're concerned and worried. At that point, the adolescent avoids the caregiver even more. And then the cycle kind of repeats and reinforces. And so, the more that the parent or caregiver tries to connect with them about this, the more that the young person might pull away, especially, when we approach this from an emotional standpoint. And so let's talk a little bit, today about how do we break that cycle or how do we stop that cycle if and how and when it appears. Some of the things that we think about doing with the families that we work with and that we found success in are to tell your child that you've discovered, a substance or some drugs and be very specific with them. And so, an example of that is I found this vape in your pants pocket when I was doing the laundry. So they kind of have some context and understanding. And it also doesn't allow kind of this back and forth of like, well, was it really what you thought it was? All those kind of questions and things, that negotiation of getting, kind of maneuvering out of the discussion. It kind of helps, put that to rest. It's always helpful to be clear that that your child does not have permission to use substances. And I think as Cori had kind of referenced before too, that strong parental disapproval of substance use is really actually one of the biggest proven deterrents for youth to use substances. And so, I think that just indicates that kids really do care about their parents and caregivers' opinions and thoughts in many ways, even if it doesn't always feel that way. And so by being clear about, not using substances, that can be really helpful in so many ways. At that point, we would talk about asking your child to quit or abstain. Sometimes that also looks like asking them to do what we call an abstinence challenge, which means like, well, would you at least be willing to quit for a day or 2 weeks? 2 weeks is kind of ideal, but like, again, figuring out like how can we kind of remove as much access and exposure to substance use as we can. And I do get that question from a lot of caregivers about what if my child isn't really interested in not using substances anymore or abstaining from substance use. And we're going to talk a little bit more in a few slides about how to kind of pull some levers and shape behavior, but really as much space as you can give between your child and substance use between now and when their brain is fully developed, again, around 24, 25, 26, the more likely they are to find other ways to cope with difficult life situations and avoid ongoing lifelong difficulty with substance use overall. We then, sometimes talk about suspending a privilege for a short period of time. We're going to talk more about that in a few slides, and then monitor your child closely to ensure that the behavior hopefully comes to a stop. And then we always encourage using your child's pediatrician's office for guidance if you're looking for some direction and where to go and what to do. Some ways that we can contain difficult discussions include choosing a time when everyone is the least stressed and most consistently available, and for teenagers especially, and maybe parents too, the most awake and alert, so that they can kind of course, absorb the information and the discussion as a whole. We often recommend with young people, especially who might be using substances, having a family meeting that has happened on a weekly cadence to be able to talk about some of these things, to avoid really having them come up throughout the entire week and cause discord and difficulty, and containing the space and the discussions to a specific time can be really helpful. Meetings can be creative, as I'm sure most of the parents out there know, that, sitting down and talking on a couch face to face is often not the best way to approach young people. And so this can be on a walk, driving to your local coffee shop, going to a cafe. I think driving in general can often be a place that I hear a lot of caregivers say they can have some of these discussions in a way that feels a little bit disarming and where folks can be a little bit more vulnerable. And then avoid bringing up these issues outside of those designated times. Again, really it's about, agreeing that like we're going to talk about some of these things at these times. And it really gives you an opportunity also to encourage your child to bring questions or concerns to you to this specific time, so that you're also not expected to have answers to all of life's hard questions sometimes at all times of the day. And then, if we kind of forget and we bring up something that really could have been in one of these family meeting spaces, it's a good opportunity to model apologizing for not keeping our side of the agreement and really showing young people, how we can, be real and be vulnerable ourselves as parents and caregivers, and that we're learning often for the first time how to be parents and caregivers in these situations. Any safety issues, the exception to that, is that safety issues should be discussed immediately. And I'd set that as a general kind of expectation or norm or rule. Don't wait for the designated time if there is a safety concern. But outside of that, if things can wait a couple days, a couple hours, whatever it may be, it can just help to have, again, that containment in that specific space. The messaging, I think, to young people, of course, is really important, and for that to be consistent, clear, and warm. And so being direct and clear about your limits and the expectations is important. It's important to tell young people that while you might dislike their behavioral choices, like using a substance, they're still loved and you still care very much about them. And in fact, that's why you're talking to them about their substance use, because you love them so much that you don't want to see them have any difficulty with substance use now or in the future. think it's really important to remain hopeful and believe that your child can make better choices in the future. I see this every day in my work at Boston Children's Hospital, that actually there's many young people who come to our program saying that they do want to make different choices. They do not want to engage in substance use, and that they make those changes, and that they, you know, go on to very successful lives, doing and meeting all of the goals and dreams that they have. And so know that is a real reality, and it's important to try to hold on to that hope so that your child can, you know, also grab onto that and remain hopeful themselves as well. And it's really important to avoid stigmatizing or kind of hopeless messages, things like you're lazy or an addict or a failure, you'll never amount to anything. Again, really goes against what I was just saying in terms of, you know, we know that young people use substances. It's developmentally appropriate for them to take risks based on kind of their brain development. It's not something we want to encourage by any means, but young people make kind of mistakes or, you know, have challenging experiences. And it's really important, again, to you know, build them up, you know, and instead of kind of adding to the stigma of substance use, and that people who use substances can't meet their own goals and kind of move beyond their substance misuse. A question I get very often in our work is like, what if my young person's friends are using substances? And so I think it's really important to not make their friend a villain or an enemy, or again, stigmatize, you know, their experience. Again, we know that young people use substances for a lot of reasons. And often when they're having difficulty or challenge in their world or life in one way, shape, or form. And so it's an opportunity, I think, to kind of empathize and have sympathy for other young people who might be in these situations. It's also fair that you're concerned, perhaps, that their friends' substance use may impact their own experience or relationship with substances. We do know that as a risk factor. And because of that, I think, you know, one thing that parents and caregivers can consider doing is setting expectations that their child may spend time with that friend who we know to be using substances only if they can do so without using themselves, and also to offer social time in structured and supervised settings. And so again, it's not about like, you can't, you know, have that person be your friend, but maybe, you know, we're going to go to the movies and I'm going to be there, or, you know, you're going to hang out at our house where I can oversee things versus hanging out at their house where I'm not really sure what the supervision may look like. One thing I wanted to very quickly highlight, and I mentioned that we do research at Boston Children's Hospital, is that we're in the midst of doing a study right now called the Lingo Study. And really it's about understanding and acknowledging that youth and adults have a very different vocabulary in general. But when we have historically asked young people to describe their use and misuse of both over-the-counter and prescription medications, we found that there might be a bit of a disconnect in how we ask those questions, and what we think we might be asking might be different than young people. And so more to come in terms of, you know, is there a different language we might want to consider using, especially in the medical space, to talk to young people about this. But in the meantime, one thing I wanted to share is the teach back method that we often use in medicine and healthcare, which when you're having these conversations about medications and things like supplements and vitamins, anything that you might take and put into your body, being able to, you know, have a discussion about it and then ask your young person to actually tell them in their own words what their understanding of the conversation was. And so, you know, I've often said like, oh, like, does that make sense? Like, are we on the same page? And it's very easy, you know, for somebody to say yes and thinking that everybody is on the same page. When you ask them to tell you back what they heard, it's an opportunity to ensure that both sides are kind of, you know, on the same page and everybody's understanding of the conversation. Now let's talk a little bit about what parents can do in these situations. And so again, like I talked about before, we know that parental involvement reduces substance use, that being able to, you know, say that you don't really approve of substance use by young people is really important. And also giving consistent praise. Young people tend, you know, to, again, the way that their brain is wired, like, you know, having praise and reward is such a motivating factor for them. Doing things together as a family. We know that one of the other biggest predictors of decreased substance use is actually having dinner together or sharing a meal together as a family. Playing games, going for walks, finding hobbies and activities has shown to reduce substance use in young people. checking in with their schoolwork and their homework, knowing when their tests are, helping them study, knowing that you're connected in on that can be a really powerful experience for young people. And then encouraging them to get involved with a club, a sport, or volunteer opportunity. I think this is important for all young people. Again, it helps us kind of ensure that we have, alternatives outside of substance use for coping. But it's especially important for young people who maybe be struggling academically. And it's really important for them to find something in a space where they feel like they excel and enjoy alternative kind of, activities. As we talked about before in that cycle, the emotional response can be really overwhelming. It's so scary to discover perhaps that your child is using substances or medications and misusing them. And so much goes through a parent's head when that happens. Those reactions are normal. What I remind people of in those situations are that facts are friends and feelings are not facts. It's important for parents and caregivers to have a place that they can express emotions outside of the communication with your teen, somebody that can be your sounding board and your support, a partner, a friend, a clinician, peer support groups, etc. It can be helpful to practice what you might want to say ahead of time to avoid reacting in the moment and responding before you act rather than reacting and acting before you think. And the STOP acronym sometimes can be helpful as well, which stands for stop, take a deep breath, be open to your options, and then proceed with what option you choose. But again, I know that that's a really challenging aspect of this, and having that support is so critical. Very quickly, we talked about before being able to set specific rules and monitor. Often we talk about kind of creating a behavior contract that's in the handouts with some expectations. And again, this is where you can kind of pull some levers and shape behavior for your young people. We talk about the 7 C's. Some of those C's in terms of what kind of motivates or can help shape behavior, things like access to a car or driving lessons, cash, computers, cell phones, and there's a couple more. But being able to, have rewards in place for not using substance use, but also having things in place for when substances are used to, again, motivate and try to shape behavior in a positive way can be helpful. In terms of schools, some ideas that schools might want to consider are making sure that they're being attentive to young people who are in that performance gap and again might be struggling academically, ensuring that they have the supports they need to be as successful as possible, to be proactive in educating families and students about substance use and misuse, and in this case, prescription medication use and over-the-counter medications and supplements. Peer-to-peer education and mentoring. Young people, I find in my experience, get so much more willing sometimes to talk to somebody who's their age or a little bit older than me at this point, in terms of feeling like there's relevance and understanding. Mental health counseling being available to students is critical, and also treatment as alternatives to traditional discipline approaches. So instead of perhaps suspending students or things like that, considering getting access to care or to treatment in that situation. And then communities, some things that communities can consider doing are being familiar with the community resources to direct families and community members to, participating in public health campaigns that help educate the community. As we discussed before, naloxone, offering that and training how to use it to prevent overdose deaths. Offering harm reduction supplies like fentanyl test strips and doTERRA bags, which are bags that help with safe disposal of substances, and educate on Good Samaritan laws, which are laws that basically protect somebody, even if they're involved in using substances, but if they are calling 911 to get help or support in that situation, that they would, not be prosecuted in the legal environment because they called for help and made sure that somebody was able to get assistance. More or less. And that's something that folks can look up in their own state and jurisdiction to see how those function and if they exist. I think that Cori's going to join me to talk a little bit more about this too, and Michelle. Yes, feel free to jump in here.
You, Cori and Amy, for all of that content and learning that you just took us through. That was amazing. And I also want to thank the 530 people that have joined us on the call today, taking important time out of their afternoon and just threading things together. There's many prevention professionals on the call with us that supported their drug take-back days in their community. I had the opportunity to be at the Oldham County event where we took in, 3 sites took in over 400 pounds of medications, so those out of the house. So that really supports what you're teaching us today in terms of safety. And I know we've talked about a lot of different ways to take back drugs. That's only one of them. Every day can be a take back day. And there's lots of ways to dispose of medications year round. But you've got 2 national take back days that you can put on your calendar moving forward.
Yeah, and some national organizations that we know can be helpful in this space. Certainly NIDA, the National Institute on Drug Abuse, so nida.nih.gov is a great resource. They have so much information about all kinds of different substances and getting help for different substances, a really great resource. Song for Charlie is another nonprofit in this space that does amazing work, especially with today being National Fentanyl Awareness Day. We wanted to highlight Song for Charlie and all of the work that they do to help parents feel empowered to talk about fentanyl with their kids and know what to do to try to get help for their kids. And then finally, we were just talking about this great resource, healthychildren.org, their medication safety resource, which I know the link is here, but it's a newly updated source. I think you said from the American Association of Pediatricians or Pediatrics.
Right.
A really great medication safety resource if you want some kind of handheld, tangible information about this topic that you can keep after this. That's a really great one to download for your own use.
We've got amazing questions lined up in the chat, and they are still coming. So we're going to do our best to get through all of those questions. Thank you to each of you that have submitted them throughout the presentation.
Yeah, and so just to highlight again the work of Partnership to End Addiction, drugfree.org is our website. There's a lot of free resources and information on that website. We have family resource centers. We have resource centers about all different types of substances like marijuana, cannabis, psychedelics, whatever you could want to know about. We also have a lot of direct to family supports. So we have a helpline where you can get immediately connected to one of our helpline specialists in English or Spanish, and they can help you through navigating a loved one's substance use and can also just be a listening ear. We also have online support groups for parents, for grandparents, for siblings. We have a grief support group. And we also have personalized text messaging programs. So if you're looking for some daily reminders or tips or tailored resources, you can sign up for our personalized text messaging programs and get some of those resources sent directly to your phone or email.
Wonderful. Thank you again, Cori. It's such a good reminder for me in this work too. I love the personalized messages piece. I'm so glad to be able to check that out after this webinar. Again, I'm Amy McCarthy Baluch. I work at Boston Children's Hospital in the Division of Addiction Medicine, specifically the Adolescent Substance Use and Addiction Program, and welcome folks to reach out to me at any point. Here's some links in terms of my email, the website that we have at the hospital. I'm on LinkedIn and on Instagram. And I had the pleasure of doing 5 seasons of this podcast, Awkward Conversations with Jody Sweeten, as Michelle kindly mentioned, where we talk a lot about these issues, and would love for you to join us in that community as well. So thank you again for your time, and it's been so wonderful to join you all. Yes, and I also had the pleasure of being able to have some access to the Operation Parent handbooks. And I'm a new parent. My daughter is 1 year old, I guess, at this point. And so I feel like in doing this work with parents for so long, I've heard about folks wishing for a guidebook for parenting and resources and support. And Operation Parent has done just that and made it available to parents and caregivers. And so I highly recommend that folks check those out on the website.
Thank you, Amy, so much for that kind endorsement. we find that the hardest part of parenting is it doesn't come with a script, but we hope that our handbooks will fill in some of the gaps. Each one is grounded in evidence-based information and designed to help parents navigate topics families are facing right now. They're written for every trusted adult in a child's life. That can include parents, grandparents, foster parents, and kinship caregivers, with very practical guidance that you can use. You can put it down and pick it back up whenever you need to. You'll find the conversation starters that take the pressure off, clear action steps, and up-to-date insights to help you feel more confident, which we hope that we've also done that today during this session. There's Spanish, Christian, elementary, and middle and high editions, and we hope that that will make things easier for your family as well as the community members that you may serve as a professional. So as adults have the right tools, they can support the kiddos in their community. And then lastly, we just invite you to continue to join us on this webinar journey. We've got 3 more coming down the pike, and this screen here allows you to do a quick registration if you haven't already, or you can go to our social channels to find the opportunity to share from there as well. You know, this year, Operation Parent, I can't believe it, but we're celebrating 20 years, and we really would love to hear from you. If our work has made a difference for you, we would love to hear your story. Maybe a webinar or a resource gave you the confidence to start an important conversation, and we would love to hear about that. If Operation Parent has impacted your parenting or your community, it's a great time for you to share your OP story with us. Your voice could really help another family take the first step with a tough issue. So you can use this QR code, or you can let us know in the evaluation if you'd like to participate in that story program. All right, so everybody ready for questions? I'll start with just an opening comment. Cori mentioned it during her section of the presentation, but it was mentioned a couple of times in the chat as well, advising for audience members to just keep up on the Benadryl challenge, to take a look at that and what's happening with that currently. So a word of encouragement to check that out. And then specifically related to that, someone had a youth that they had just met with tell them that they had been using Benadryl to sleep, but they are now also using cannabis to help with sleep. So in your work, both of you can respond to this. Do you see a higher risk for prescription drug use for kids who are already using something? I think they're meaning like also co-use there. So the end of that reads, for kids who already are using or have used another type of substance.
Yeah, I can start, and then definitely I'll pass to Amy to chime in as well. But I think there's definitely a bi-directional relationship. You know, if a young person is using or misusing prescription medications, they're certainly going to be at higher risk for using other types of substances as well. And for a teen that's maybe already using other substances like cannabis, they're also going to be at a higher risk for misusing prescription medications. We know that a lot of the risk factors for both of those would be the same. Some underlying risk factors of like the availability of substances and parental monitoring that's maybe not so intense. But definitely, and for in this case, talking about a teen that's trying to use substances to sleep, you know, I think it is understandable that if you can't sleep, you're kind of desperate for whatever is going to help you feel better. And so for a young person who's maybe using cannabis to try to sleep, if they don't have cannabis right then, they're going to go to the medicine cabinet and try to find whatever else there is that could help them sleep in that moment. And so, you know, definitely risk for one will impact risk for another. Yeah, Amy, any other thoughts there?
Yeah, no, I agree with all of that. And, a couple of things I might highlight is I think there's an opportunity to talk about the idea and concept of self-medication with young people in this space, like what's the function of your use? Why are you using substances? And, why is it maybe, that you're using these substances, and might we be able to talk to a doctor, or a medical provider about your sleep challenges? One thing that I found really fascinating through doing this work in adolescent substance use is we've actually found out, and by we, I mean a lot of scientists who aren't me, but I've been able to share their learning, is that cannabis does actually have an effect where it helps people fall asleep faster. But there's a big but, which is that the quality of your sleep isn't as strong. And so I work with a lot of young people who say, it helps me sleep, it helps me sleep. And then what they actually find out is that cannabis, ends up actually impeding their sleep in some ways. And it creates, again, this cycle of like, well, I need more cannabis to sleep because I'm not sleeping as well. So I think there's, again, some opportunities for education, for support, and connecting young people to medical providers. If you're taking anything to support your sleep that isn't prescribed to you by a doctor, it's a good idea to kind of reroute that and get some support and feedback in that way.
Excellent thoughts and perfect segue to the next question. What are your all's thoughts about melatonin?
I'd say I'm not a doctor. I work with a lot of doctors, so I kind of play one on Zoom, I guess, sometimes. Obviously, just kidding. I would say the same thing. I think that if you are having difficulty, and again, whether it's with sleep or any other issue, or your young person is, it's a wonderful opportunity to talk to their pediatrician or their primary care provider to get feedback about what options are out there for them. I've heard, a lot of people have a lot of success using melatonin, and with that being said, I've heard people who haven't. And even though it's a over-the-counter, kind of supplement that you can get access to, it can be misused or, used in ways that are unhelpful and actually have the opposite of the intended effect. So that would be one of my thoughts. But Cori, anything additional that you have?
Yeah, I mean, you really kind of nailed it there. I recently looked into this because I was so interested in the evidence for melatonin, and it's really kind of all over the place. There's not great evidence that it works well for adults in kind of population settings. And as far as I know, it's never been studied in youth. And so there's no evidence that I know of that it works to help for sleep in young people. So yeah, exactly. Like getting to the root cause of the sleep issues rather than, trying to depend on any type of supplement that may or may not be effective. There's a lot of other things that we can do to try to improve sleep.
Yeah. And if your pediatrician doesn't, there's also I work at a hospital where we have a pediatric sleep center. So there's lots of experts in this area of pediatric sleep that might be able to help direct you and guide you.
Amy, folks were interested in having you repeat the name of the document you can give to a doctor to let them know you want an alternative to opioids.
Sure. So I've known about it in Massachusetts, but a quick Google search suggested that it's beyond Massachusetts, but it's called the Voluntary Non-Opioid Directive. And so if you Google that term and your state, you might be able to see. And I think regardless of if your state is using that as a tool, it's an opportunity, to have a conversation with your medical providers and medical teams, your own or your children's, about preferences and plans and options, and including alternatives to opioids. Again, my hope isn't to villainize opioids and pain medications. I'm not a doctor. Again, I think it's an important conversation to have with your medical provider to make the best choice for yourself and to know what all your options are.
Do both of you have some recommendations on implementing some strategies for reducing prescription misuse and access that can be low cost and scalable for a community?
$1 million question here. It's a great question.
Yeah, I mean, from a prevention standpoint, maybe this isn't the most helpful answer, but so many of our upstream prevention strategies where it comes to helping parents positive parenting strategies, giving kids extracurriculars, making sure that kids get screened for mental health issues. All of these really upstream things are certainly going to reduce prescription drug misuse because they're also going to reduce marijuana use and nicotine and all of these other related substance use behaviors, and just in general, all of the negative health behaviors that we're concerned about for kids, violence, bullying, as much upstream prevention as we can put our resources in. We know that it's a cost-effective measure for all of these negative health outcomes, including prescription drug misuse. But I don't know if Amy has kind of more specific ones.
Yeah. I mean, not necessarily, but one thing I think about is, in working with young people and with families is that, kind of cliche, but knowledge is absolutely power. And I think that, even now as a parent, like, you think about things like melatonin and you're like, oh, I think it's safe, or, it's, and often it can be, but again, it can have misuse potential as well. And so being able to, have folks in that prevention space who can go out and do this education, in public spaces like schools or churches or community centers and things like that, I think can be a low cost and scalable. I mean, not no cost per se, but low cost, and accessing more of these conversations for parents and caregivers, is essential, I think, in that way as well.
So good. So good. Have you seen any successful endeavors to get medication lock bags or boxes or the disposable kits into the right hands? Have you seen those funded creatively in some communities?
There are boards of health typically in all communities, and I think they can be a good resource or a starting point to connect with to see if they, again, your child's pediatrician sometimes I think is more, or perhaps there's like a social worker or a case manager at a pediatric office that might be able to help, asking school officials. I think about these things, the places where kids live and thrive often is where, where you can kind of get connected to some of these things often.
Yeah, and I'll just add, if you're someone who's in an organization that does this work, a lot of opioid settlement funding will have specific call outs that money can be used for things like that, lock bags, lock boxes, drug deterrent. So if you're researching grants and things, those are a great place to start for that.
Outstanding. If you have a drug-free community in your area, there's definitely someone on that committee that would know who has some lock boxes stored that would be a great reach out to. All of those avenues are excellent and available in all communities, I would think. So that's great. Amy, can you give us one more example of wording?
Yeah.
When you're asking a young person to say back the conversation so that we can ensure we're speaking the same language and that there's an understanding?
Sure. I think one thing, I might consider, obviously be having probably a somewhat full discussion, although not too long. Young people's attention spans are pretty short, but, if the conversation was something along the lines of, like you should only be taking any medication, pill, supplement that's prescribed by your pediatrician, or, in collaboration with me as your parent or caregiver, then I'd ask maybe the young person to say, can you tell me a little bit about, or can you tell me what you just heard me say? And if they say anything different, then I heard that I'm not supposed to take any medication without the doctor and you knowing, then okay, great. I've got a little bit more work to do, to make sure that we're on the same page, I would say, if that helps.
That helps. Yeah, that's great. Cori, suggestions for, actually, I want to do this one first. Sorry. Do you have an idea on some statistics or just general information about how often youth are actually buying fake pills and where they might be getting those?
Yeah, and so it's hard. That is a difficult thing to track, but some of our national surveys, like Monitoring the Future and the Youth Risk Behavior Survey from the CDC, and National Survey on Drug Use and Health, will ask kind of questions that get at that. And so what we know is that for young people who are getting and misusing prescription pills, the vast majority are either being prescribed them themselves or getting them from friends or relatives. So it's a much smaller proportion who are buying them from a stranger or a drug dealer or getting them off of social media. We certainly know that happens, and that social media can be, unfortunately, a source for young people who are trying to get prescription pills for any variety of reasons. But it's way less common than finding it in the medicine cabinet because it belongs to mom and dad, or being prescribed it for their own purposes and then going on to misuse it. So it's, of the less than 10% of high school seniors that have engaged in any type of illicit drug use, a much smaller proportion, like less than 10% of that number, are getting them from drug dealers or strangers. So it definitely happens, but it's not nearly as common as maybe parents are led to believe.
Yeah. I also think to expand on that, again, I think it's probably pretty clear from our discussion today, but the message is like, it's dangerous no matter if you get it from a drug dealer or from your best friend in some ways. And I think the most recent figures for the kind of small amount of young people who do get them from drug dealers or from other folks on social media, 7 out of 10 of those pills, so 70%, my math's not usually good, but I'm pretty sure that's 70%, have been tampered with in some way, shape, or form. And so I think that's, still helpful thing for parents and caregivers to know, but also an education point to share with your young people. And often when I'm meeting with young people, I'm talking with them about, again, if you didn't get that medication from a pharmacy yourself, like you don't know and you may trust your best friend or, another family member to not, but they may not know, right? And unintended consequences happen, even when people have good intentions. So unless you know that came from a pharmacy, it's safer to not take it at all, especially if it's not prescribed to you.
Very good. So if you have your name on the prescription, it's yours. If not, you guys can practice at home the refusal skills and saying no to those. Someone on the call works at a health department, and they agreed that that's a great place to go. Their health department has lock boxes, and so that's a great place to start looking. So we're not saying that every health department has them right now, but it is a good place to try, see if you could get one. And there are pretty affordable ones on Amazon too. So you may be able to find a small one at pretty affordably if there's some things that you want to get locked up in your home pretty quickly. Great. Okay, let's see here. Let me get one more. A little bit out of the realm of what we're talking about, but I know parents are hungry to know this. Recommendations or resources related to caffeine use and how to help teens with that, with all the products out there that have such high amounts of caffeine in the energy drinks and things. So I know that's a little bit outside of what we're talking about, but I think it would be a great place to spend a couple of minutes. And then I'm going to give our closing comment.
Yeah, that's an interesting one. I can start and then I'll pass to Amy for her thoughts. Kind of similar to what we were talking about with young people using Benadryl or cannabis to try to sleep. There is this very understandable need that young people have to stay awake. They are often doing homework till late hours of the morning. They're not getting enough sleep. We know most teenagers are not getting the mandated 8 or 9 hours of sleep per night. And they have really strenuous lives. They have a lot going on. And so it's really understandable why teens would be motivated to reach for these drinks that they can get at a gas station or anywhere with really wild amounts of caffeine. And so when we understand that motivation, we can try to change those environmental risk factors. And so as much as we can, trying to help them with time management so that they can go to sleep at a more reasonable hour, trying to help them plan out their workload so that they can get more sleep during the week, helping them to keep a routine so that on the weekends they're not staying up late either, really trying to do all that we can to structure their lives where they might not need that caffeine. I don't know about resources for trying to dial back caffeine use. I certainly could have used them when I was in high school and college. But that's understandable, but that's a tough one for teens these days. Amy, what else?
Yeah, and the marketing is so strong, just like the marketing for vapes and for these other things like Stony Patch Kids, I think is what you shared, right? Like it's so savvy to appeal to young people and the flavors and taste and all those things. So, I understand, like you said, to the appeal there as well. I think you're spot on in terms of like, again, what is the function of your use of caffeine? Like where is that maybe coming from? And being able to look at, are there other ways that we can support you kind of with that? Can we also, again, just provide education? I find that a lot of young people, they just don't, it's like caffeine, people drink it in coffee, it's in tea, like, it's in chocolate, like people, it's not thought of as kind of a substance that can do harm. And so I think being able to provide that education and knowledge is really a helpful thing too, so that young people can make the best informed decisions about their choices. Yeah, and for what it's worth, my husband just came home from the doctor yesterday and told them that apparently caffeine can make kind of your bladder kind of angry and like make it kind of irritated. And I was like, I had no idea. So again, your doctor and medical providers are a great resource in terms of that education and those alternatives, I think for sure.
That's great. Great advice for teens and for us parents on the call too, to think about our caffeine intake. So lastly, we had one of our audience members who works for poison control, and she would like for me to share out the poison control number and for the audience to know that it's open 24/7. There's no judgment. If you're not sure, you can still call. And so that number is listed here. We're going to encourage you to go ahead and take a minute. Amy did it while we were listening to speak. Put it in your phones right now. It's 1-800-222-1222. So basically all two is with a 1 in the middle, and you will have it in your phone and available should you need it. So any closing words of wisdom or anything that you didn't get to say during your presentation, any burning last minute wisdom for us?
I can go first. One thing actually I was just thinking too about caffeine, for what it's worth, is modeling our own behavior as parents too with our own use of caffeine for what that's worth. But I so again appreciate the opportunity to work with you all and to have this conversation today, and the folks that are doing work out in the field who are on this call as well. Thank you for all that you do. Please feel free to reach out to me if I can be of assistance. And this is such an important topic. I'm so glad I was able to be here today.
And I was going to bring up modeling as well. So thanks for that segue, Amy. I think so often when we're talking to parents, we hear parents that are they feel like their actions don't matter and what they're saying doesn't matter. Their kids aren't listening and they're feeling somewhat frustrated with that. But we know through research and so many years of prevention science that parents and caregivers are the most important factor in a young person's development and their attitudes and their beliefs and their perceptions. So what you do matters. And so then that they're watching you and learning from you, not to put pressure on that, but it is, your perceptions really make a difference in young people. And by you being here and being open to learning more information, that's just a really wonderful sign. And so it's very heartening to see so many parents and professionals on the call. And I'm so happy to have been a part of it.
100%. Parenting is literally the best job you can ever have. And then I hope you know that Operation Parent is here to help you on the tough days and the great days. And Amy and Cori, I just want to say it has been an absolute pleasure getting to know you better and working with you on this production. And I'll look forward to when we can do something again soon. Thanks everybody on the call. We'll see you hopefully at the next webinar.